The federal government has shut down with no easy solutions in sight. This week, the Minnesota Hospital Association's Director of Federal Policy and Regulatory Affairs, Becky Wifstrand, is back with an update on the impasse. In this episode, we've got an update on what's going on now that the federal government has actually shut down, with healthcare and hospitals in the eye of the political storm in Washington. Becky Wifstrand is the Minnesota Hospital Association's Director of Federal Policy and Regulatory Affairs and has her eye on Washington. I asked her for an update.
It is day 2 of the government shutdown, and actually there's no votes today right now in the Senate just because they're on recess because of Yom Kippur, the Jewish holiday. So yesterday the Senate did come back and try to reach an agreement and voted on sort of the same bills that they've been disagreeing about, and it still didn't pass. So right now, the Republicans want to pass a clean continuing resolution until November, and this would mean to extend current federal funding levels while they take more time to try to reach full agreement on the full year federal budget. But the Democrats are really concerned about some of the healthcare provisions in the One Big Beautiful Bill Act, as well as the extension of the enhanced premium tax credits from the ACA, which expire at the end of the year. So no signs of it coming to agreement. The vote on the clean continuing resolution did get a few Democratic votes. So the senators from Nevada, Pennsylvania, and Maine, they all voted, but they need 5 more Democrat votes to be able to get that clean continuing resolution across the finish line. And really, there's just been no progress made in the last couple of days. So we're waiting on pins and needles for that.
Yeah, I've been reading that they seem to be at this sort of, you go first, we're not going to negotiate unless you turn the lights back on, and we're not going to turn the lights back on unless you negotiate.
Exactly. Yeah. And I think, the big sticking point, as I just mentioned, is these enhanced premium tax credits that were originally extended during the COVID pandemic to give people a little bit more support in terms of buying their healthcare coverage on individual marketplaces, which in Minnesota is MNsure. And right now, the Republicans are really characterizing that policy demand as providing healthcare to illegal aliens, which is just really not true. Illegal aliens cannot buy healthcare off of MNsure, or healthcare coverage, I should say, off of MNsure. And they're really mischaracterizing kind of how this negotiation is going. So I think there's a lot of confusion in the American public about what's going on with this. But the Democrats right now are holding strong in terms of wanting to get that extension, even though that they don't expire to the end of the year. They see this as a really important inflection point to get that policy done, just because a lot of the insurers are trying to set their rates for next year. And a lot of Democrats see this as the last big legislative vehicle before the end of the year to get this done.
So when Republicans talk about healthcare for illegal aliens, they may be referring to emergency Medicaid, which occasionally does go to people who are undocumented. They're also apparently looking at directed payment programs and upset about that. The Paragon Institute has been, issuing policy statements about how opposed they are to this. Are those things going to go away as part of this deal? Like, do they have legitimate criticisms that's going to be dealt with in this negotiation, or are those going to come out in the wash anyway?
Well, as part of the One Big Beautiful Bill Act, and we can talk about this in a further podcast about the immigration provisions in that bill, but there were some provisions that restricted certain immigrant groups enrolling in coverage in certain programs like emergency medical assistance, like you just said, and on the individual marketplaces. So technically that is within the Democrat-supported bill right now in terms of rolling back some of those One Big Beautiful Bill provisions. But as most people know, that's just not politically feasible. And really, I would say the big focus is these enhanced premium tax credits. That's really, really the sticking point for most Democrats. Well, I think the concerns about the Medicaid provisions in the One Big Beautiful Bill are more of just political theater right now. I think the focus is really on the tax credits. So, we saw in Minnesota yesterday, they released the rates for the next plan year for MNsure, and we're looking at increased premiums by about 21.5%. And this is without taking into account the expiration of the tax credits. So these enrollees are really going to see their premiums get increased if Congress doesn't come to a deal.
And do you know how many people that involves?
So in Minnesota, it's about 90,000 people that could have a higher premium, and potentially almost 20,000 people could lose all financial help in terms of buying plans on MNsure.
So the shutdown obviously is happening in Washington, but the federal government is all over the place. What are we seeing on the ground? What's the impact on healthcare of this shutdown?
Yeah, so MHA has put out some information. I mean, luckily in healthcare, a lot of the main Medicare and Medicaid funding is mandatory spending, which means it's not affected by the annual appropriations process and therefore not affected by this government shutdown. But the really big impact is staffing across federal agencies. So the Department of Health and Human Services has put out some contingency planning in terms of how many people will be furloughed. And then there's been some announcements from the administration that they may move to laying off staff. And so, as you can imagine, agencies like CMS are fairly large, have a lot of staff. And so if we see those reductions in staff, then obviously that's going to trickle down to operations within hospitals and health systems. So, potentially this can affect grants, this can affect the surveys, just a lot of different operational issues with hospitals and health systems. And so we'll see how it moves forward. I think there's a lot of concern that this shutdown in particular could go longer than we're expecting or we've seen in recent years. And that could really affect us in the long term.
Okay, and I'm going to cue up the greatest hits again for us because we talk about this all the time. Hospital at home and telehealth, those things that you constantly say are up for renewal and getting kicked down the road for another day. And lo and behold, that day has arrived, apparently.
It has. And so unfortunately, a lot of really important policies for hospitals and health systems were tied to that September 30th expiration date. And so like you said, the big one is the Medicare telehealth flexibilities. And this really is around the originating site requirements and the geographic requirements that were expanded during the pandemic and that have been extended but are now expired. And so as you can imagine, for a lot of our hospitals and health systems who have been operating really successful telehealth programs last few years, this is a huge concern for their Medicare patients. So right now, the official guidance is to hold claims on those telehealth visits until hopefully the government is up and running and that extension is passed and they can get reimbursed for that. But I know a lot of our members are concerned in terms of what that impact may be. So, I mean, a lot of our members are also starting to reschedule patients and potentially have to push appointments, which obviously is going to affect patient care. I also want to mention the hospital at home program, which a few of our health systems in Minnesota participate in. That authorization also expired with the September 30th deadline. So now those patients must be discharged or transferred back to the hospital. So again, we're seeing some real impacts on patient care that we're concerned about.
And you said there were some geographic restrictions. Tell me a little bit about that, how it's working.
Yeah, so before the pandemic, telehealth in Medicare was only allowed to be used in rural areas. And given, obviously, the effects of the pandemic, they expanded it to all areas, so in urban areas as well. And so we've seen, huge uptake in that because, obviously, populations from all different geographic areas can benefit from telehealth services. So this would be a huge policy shift if this doesn't get extended. And so that's why we're so focused on it.
So Minnesota obviously has 10 representatives at the Capitol doing our business up there. What are Minnesotans in Washington saying?
Well, as you can imagine, they're falling along party lines right now in terms of what Republicans and Democrats are prioritizing. Our House members are really reiterating that they've kind of are separate from the situation now. It's really focused on the Senate because the House did pass that clean continuing resolution since they do have a Republican majority. So obviously our House Democrats are concerned about not addressing the enhanced premium tax credits, but it really falls to the Senate right now. So obviously both of our senators, Senator Klobuchar and Senator Smith, are Democrats, and they're really focused on that impact on healthcare costs, and they're really falling in line with their Democratic colleagues and urging this deal to include some consideration of that issue before they can vote on it.
So the shutdown is also coming at a difficult time. It's opening of open enrollment for a lot of people. Marketing for Medicare Advantage programs started this week. We already know that some of those prices are going to go up considerably, and we still don't know what kind of help they're going to get, if any, from tax credits from the ACA. What's next here? Are they going to be able to sort this out in time for people to make their plans for next year? And what are healthcare providers and health systems looking at?
Yeah, that's a great question. I mean, I think the overall message of this shutdown is it just introduces so much uncertainty in healthcare right now. So, as we talked about with a lot of more general operations in terms of what hospitals and health systems rely on the federal government for, but as you pointed out, these enhanced premium tax credits for a lot of patients and their families and how they're going to pay for healthcare next year. So the Senate comes back to continue voting tomorrow, and we'll be voting throughout the weekend and trying to reach that deal. So it really comes out down to those politics, and we hope they make a decision so that people can make more educated decisions on what they need for their healthcare for next year.
I think all Minnesotans would appreciate that.
Absolutely.
All right, thanks for the update.
Thanks, Tim.
Again, that's Becky Wifstrand. She's the Minnesota Hospital Association's Director of Federal Policy and Regulatory Affairs. I'm Tim Nelson, and you've been listening to Hospital Matters from the Minnesota Hospital Association. Join us next time for another look at issues impacting hospitals, health systems, and patient care in Minnesota. Thanks for listening.